Right now, the way that we teach ultrasound is by having trainees do ultrasounds. However, you need to do hundreds or thousands of ultrasounds, not only to feel comfortable with the procedure, but then to have the opportunity to see some abnormal cases. And I think simulation, apart from initially training somebody, which is for ultrasound is relatively straightforward, I think the big use is going to be, the big benefit is going to be when you are able to use the simulator to actually teach ultrasound for pathologic findings that are relatively rare but very important for them to have the skills.
I agree. It will be critical for the new learner who's never seen these cases, and maybe a while before they see them, and the case may be buried in the middle of a very busy day for them. So to have seen some findings on ultrasound for a rare case will be really critical. I see the use of this. We know that many of our allied health professionals do ultrasounds now, and so not only for the physician, but for all of our other allied health individuals who are also being used for doing ultrasounds, particularly in parts of the country where the care may not be as prevalent. I mean, you have two types of ultrasounds. The one are the real ultrasound volumes from real life patients, which are critical for a new trainer to see, particularly when they're less common. On the other hand, you have the truly simulated and developed ultrasounds of second and third trimester fetuses. And to teach fetal anomalies for individuals, who are going to be doing these ultrasounds is really, really critical. I mean, you have two things going on. One is you're in the middle of an ultrasound and you find an abnormality, and the second thing is you have a patient laying there who has to learn this material and has to learn that she has a baby with an abnormality. And so you have to be able to do the ultrasound and identify the abnormalities, and then somehow provide this to the patient in the best possible way. Simulation's here to stay. It's not going to go away. And I think that there are many, many, many procedures that we do that would lend themselves to simulation. The time of see one, do one, teach one is gone. And it should be gone, overall. And now it's do simulated procedures over and over again. Do them repeatedly to the point where you feel comfortable, you can identify them.